This video will demonstrate taking alginate impressions on a patient. Please review the previous video and the lab manual for the correct technique of mixing alginate impression material. There are two tray types that can be used to take an impression: disposable plastic trays and metal trays that can be sterilized. Impression trays come in small, medium, and large sizes. If the tray needs to extend distally, it may be built up with beading wax. Metal trays have a rim lock edge and many perforations that prevent the alginate from separating from the tray when removing it from the patient's mouth. Since these trays are sterilized after use, adhesive is never used on these trays because the adhesive cannot be cleaned off. Disposable trays must sometimes be coated with adhesive to prevent the alginate from separating from the tray. This is especially true for trays with few perforations. Prepare the materials you will need with clean hands. Tumble the closed alginate canister. Fill a scoop and tap firmly until the powder is condensed in the scoop. Scrape off the top of the scoop with the spatula. Measure out 2 scoops into 1 dry bowl for the mandibular impression. Measure out 3 scoops into another dry bowl for the maxillary impression. Replace the canister lid to avoid contamination of the alginate with water. The water measures are ready with room temperature water. Warm water will accelerate the set of the alginate and cold water will retard it. Estimate the size of the trays that will be needed and size the trays in the patient's mouth. A barrier must be used on the disposable tray so that it will not be contaminated. Metal trays can be sterilized, so they do not need a barrier. These directions are for the right-handed clinician. Left-handed clinicians will reverse the directions. To check the fit of the mandibular tray, the clinician stands at 8 o'clock. Hold the handle of the tray with your right hand and turn it over. Retract the right cheek with the index finger of your left hand. Hold the tray sideways and insert, using the side of the tray to retract the left cheek. Rotate the tray into the mouth until it is centered. For mandibular trays, lift the front of the tray up and visually inspect that the alveolar ridges clear the tray. Ask the patient if the tray feels comfortable. To check the fit of the maxillary tray, the clinician stands at 8 o'clock. The insertion of the tray is the same as for the mandibular tray. When the maxillary tray is in the mouth, lower the front of the tray to make sure it clears the alveolar ridge. Ask the patient if the tray feels comfortable. Ask the patient to rinse with full-strength antimicrobial mouthwash for 30 seconds. Gently stir the water into the powder until the mixture is completely wetted. Then spatulate vigorously against the sides of the bowl to prevent air bubbles. Fast-set alginate requires 45 seconds of mixing for a creamy consistency. Gather the alginate onto the spatula and load the mandibular tray from both sides. Use a wet finger to smooth the surface of the alginate before taking an impression. You are now ready to take the mandibular impression. The right-handed clinician stands in the 8 o'clock position facing the patient to take a mandibular impression. The chair is raised so the clinician does not have to bend, and the patient is seated upright. Hold the tray handle with your right hand and turn it over. Retract the right cheek and hold the tray sideways and insert, rotating the tray into the mouth until it is centered. Seat the tray gently over the teeth and tissues from posterior to anterior. Immediately muscle trim the impression by bringing the patient's lower lip up over the tray edge. Instruct the patient to lift their tongue and relax it. Hold the tray into the patient's mouth until the alginate feels rubbery and does not stick to your fingers. The set time of alginate using room temperature water is 2 minutes and 30 seconds from the start of the mix. Once the material has set, break the seal with one finger in the left vestibule of the patient's oral cavity. Snap the tray out quickly to minimize distortion. Remove the tray by rotating it out of the oral cavity. Ask the patient to rinse out excess alginate. Rinse the impression under running water. Spray with disinfectant, but do not soak an alginate impression in liquid disinfectant due to the likelihood of imbibition. Wrap in a paper towel that has been wetted and let sit in a bag to maintain 100% humidity. For the maxillary impression, the right-handed clinician stands at either 11 o'clock or 12 o'clock. The chair may be lowered slightly to have a better view over the patient's head. Remind the patient that they will breathe through their nose during the impression. For the maxillary alginate impression, add 3 measures of water to 3 scoops of alginate powder. Spatulate vigorously against the sides of the bowl to prevent air bubbles. Load the maxillary tray from the posterior. Use a wet finger to smooth the surface of the tray, and you are now ready to take the maxillary impression. Standing at 11 o'clock, retract the patient's left cheek with your left index finger. Holding the tray sideways, use an edge of the tray to retract the patient's right cheek. Insert the tray and rotate it to center it in the mouth. Align the handle with the midline of the central anterior teeth. Seat the posterior of the tray first and lift the handle to seat the anterior. Muscle trim the patient's upper lip around the tray rim. It helps to hold the patient's head upright with your left arm behind. This prevents the patient from tipping their head back and helps to prevent gagging. Hold the seated tray until the alginate feels rubbery. To remove the impression, stand at 8 o'clock in front of the patient and break the seal in one of 2 ways. First, have the patient close their lips and blow to puff out their cheeks. If that does not release the seal, bring your right index finger along the left edge of the tray and break the seal manually. Snap the tray out quickly to minimize distortion. Use a finger of the left hand to create a cushion over the opposing teeth so the tray does not snap against their mandibular teeth. Remove the tray by rotating it sideways. Instruct the patient to rinse out excess alginate. Provide the patient with a wet towel and mirror to wipe excess alginate off the skin. Rinse the impression under running water and spray with disinfectant. After 10 minutes in contact with the disinfectant, rinse the impression before pouring it in stone. It is recommended to pour the impression as soon as possible, as distortion increases due to delay in pouring and evaporation.